Hi, everyone. I'm Kira Sorrells, and this is NICUnity. NICUnity is made possible by the generous support of Chiesi USA and is NICU Parent Network's all-encompassing educational initiative to foster a culture of belonging for all of our members. Whoopsie. Sorry for that echo. Um, this is our all encompassing educational initiative to foster a culture of belonging for all members of our community. Our monthly schedule of NICUnity discussions, leadership lounges, and special health topic webinars bring together NICU parent leaders, adult former NICU patients, healthcare partners, and maternal infant health stakeholders for candid discussions about diverse experiences in the NICU and beyond. We want to shine a light on those who are often marginalized, silenced, and underestimated, and we are thrilled to provide this platform for raw, authentic conversations. So, thank you for joining us as we embark on this journey of learning, growth, and unity. Together, we will build a stronger, more inclusive NICU community, one conversation at a time. So, today we're going to delve into the barriers that are often experienced by mothers in accessing mental health services. And we're also going to explore strategies for advocating for mental health and empowering NICU mothers. Our guest today reminds us that improving access to mental health services is a community issue. We have to ensure efforts are aimed towards the promotion and prevention of perinatal mental health disorders across all settings. And we also have to ensure that strategies for advocating for maternal mental health consider structural and social barriers to ensure maternal mental health equity. This is an important discussion to have for anyone who works in maternal infant health and is vital to our understanding of how to truly support families. So, together, let's shape that supportive community for resilience and growth. I'm delighted to welcome my co-host, Gigi Kanyangwa Fernandez, who is the founder of GKF Consulting and Coaching, former NICU mama, mama to 4 angel babies, and our current NPN board president. And we are joined today. Hi, Gigi, joining us all the way from London. And today, our special guest is Dr. Celeste Poe, who is a licensed clinical psychologist certified in perinatal mental health. She is a clinical instructor and director of the NICU Psychology program at Lucile Packard Children's Hospital in California. In her role, Dr. Poe provides psychological support to parents of infants hospitalized in the NICU and throughout the hospital. Thank you so much, Dr. Poe, for being with Gigi and I today.
Yes, thank you for having me. Excited to be here.
So let's start off with a little bit more about you and your professional background, and how did you find yourself in this field of maternal mental health?
A great question. So I think even before I went to college and pursued higher education, anyone that knew me as a kid knew that I wanted to hang out with the babies. I was always really in awe of this connection between parents and their babies, even as a young child myself. And so I think I was very lucky when I started to pursue a career in mental health that I kind of already knew what I was interested in. And so I started after college pursuing my marriage and family therapy degree and license, and was fortunate enough to be able to work with families of very young children, particularly who had experienced trauma. And that immediately clicked for me as a population that I wanted to continue to work with. But interestingly, around that time, I also recognized that a lot of the literature and research from decades ago, when they would talk about mothers, it was sort of in this very critical eye or lens of sort of, children end up, having difficulties because of their mother. That was, a long time ago, but it certainly, there were traces of it still, even as I was in school. And so I really had the question of how do we actually support mothers? Their role is so powerful. So how do we show up for them in ways that we can empower them? And so as I pursued my doctorate, I really wanted to think more about how to do this from a sort of strength-based approach, but also especially in circumstances of trauma and grief. And
Mm,
so, sort of what added to my training at that time was working in the medical setting and working with children with chronic illnesses. And so all of my work kind of came together in the NICU, where I'm able to sort of do all of the things that I'm really interested in and
Mm,
really enjoy. So now I get a lot of fulfillment out of supporting families during those circumstances and beyond.
mm,
mm. That's great. You know,
yeah.
I didn't realize that um, that mothers were often kind of blamed. That's
Yes, I think historically
shocking.
historically speaking, it was sort of,
Yeah.
children have difficulties because there was some feeling on a parent's part early on, which was
Hmm.
such a limited frame of reference and really not capturing the full picture. And so
Right.
I think, even today, there's a lot of social expectations and pressure on moms in terms of needing to do it all and do it all very well. And so
Hmm.
I think that we've moved a long way from that, but I do think that we
Hmm.
have a long way to go.
Oh, for sure. And
Mm,
I just think about what that must have done to the mothers who, who were experiencing a, perinatal mood and anxiety disorder, had a traumatic birth experience, a sick child, where we're already blaming ourselves.
Mhm.
mm,
It's so common to, I mean, I know I did.
mhm, mhm,
um, from my own personal experience as a mom, I went through infertility. I had a high risk, high order multiple pregnancy, experienced multi-fetal reduction, preterm delivery at 25 weeks, lengthy NICU stay, sudden loss of a child, older than a year, and then a later miscarriage. And I mean, my reproductive history has certainly been prime ground for mental health issues. And
mhm,
after my daughter died, I was diagnosed with generalized anxiety disorder, PTSD, and major clinical depression. But it wasn't until 6 months after my daughter died that I was referred to a maternal mental health psychiatrist by my OB. And I didn't even know that that was such a specialty at the time.
mm,
Um, I really was, it was only then, I think, when I was seeing someone who was trained in the intricacies of maternal mental health that I really began to heal. Um, so, is maternal mental health a relatively new specialty, or do you think is there a general lack of awareness that the specialty exists? What do you think about that?
Yeah, I mean, I think both are true, to both of
Mhm,
those questions. I think that the interest in reproductive health and having children has been an interest of society for centuries, probably. But I
mhm.
think in the ways that we actually think of this as a specialty, and that needs specialized training, that is relatively new compared to a lot of other areas of healthcare, but even within mental health specifically.
Yeah.
So, the organization Postpartum Support International was really one of the first organizations to really start talking about maternal mental health and,
Mhm.
increasing training, awareness. And there have been several since, but that was only about 40 years ago that that was first
mm,
established. And so,
Yeah.
again, thinking about relatively speaking, this is a pretty new field. And even with dozens of new trainings and offerings available for maternal mental health and perinatal mental health, there are still many people, even within mental health care, who don't know that this is a specialty. So, for
yeah,
those who are trained to treat mental health conditions, they are maybe not aware that this specialty exists or that there are trainings out there that they can get. And so,
Mhm.
even when moms sometimes are connected to mental health providers, they're not always people who have had specialty training, unfortunately, in maternal mental health.
Yeah.
mm,
And so, how
mm,
important is that to have that specialty training? I mean, I know from personal experience, it was a world of difference for me.
Yeah.
Um,
Yeah, I mean, I think it's a huge difference. I think sometimes people think of, for example, postpartum depression as just a depressive episode after having a baby, but it's so much
mhm.
more complex than that.
Yes.
It's not something as simple as being able to take your experiences with other populations and just simply kind of mapping it on to
mm,
the the perinatal period, there are so many changes happening biologically, socially, physically, that really having that specialized training is so important. And speaking about Postpartum Support International and how new this sort of specialty training really is, they were the first to create a certification in perinatal mental health, and that was in 2018. So it's very, very recent. And, that certification is actually something that providers across disciplines can get. So you don't have to be a mental health trained provider to receive that training. So I think we're starting to really expand what it means to be trained in this specialty, which is exciting. But again, we have a long way to go.
Yeah. Can I ask a query?
Yeah.
I was just wondering. I mean, I think it's fascinating what you do, and I love that you've loved it from a young age, because that just means you bring a certain passion to it. So it's not just, okay, my job and something clinical, but it's from your heart as well, which is beautiful. But I was just when you talked about the blaming, I was thinking that is so true, and how important it is for us to be aware of that, to change the narrative, because in my work, I hear lots of mothers particularly saying, even if they left the NICU, there was a little bit of, how dare you leave the NICU because you're the mom, whereas the other parent could, and it was just, so it just lets you realize just how it seeps through in so many different ways, even those kind of subtle ways as well as blatant ways. But I was just interested to hear your thoughts about what do you see within your work, sort of the most common themes that come out when we're talking about, having to have difficulty accessing awareness and also accessing mental health care. And then sort of the second part of that is, what are maybe some different barrier issues or access issues that you see in underrepresented groups, underestimated groups?
Yeah. That's a great question. So I think to start with your very last question, I think there are some really huge barriers that we need to overcome to making mental health accessible to all groups. Some of those really include a lot of the structural barriers that exist within our society. So economically speaking, there are families who cannot afford a specialty mental health provider, or there are certain states or areas where insurance does not cover this sort of specialty care. We also know that there are major language barriers that really make it challenging for people to be able to access the kind of care that they can connect with. And then we, just spoke about the lack of trained providers. The field itself is really overburdened. And so we really need to be thinking about how to expand this sort of specialty care. And while I will say that those issues are by and large the biggest ones that we need to overcome, the theme that I would say is actually most prevalent, because it crosses all sorts of groups, is this lack of awareness, the lack of stigma, the narrative that you kind of spoke to about, well, as the mom, you're supposed to do this. So even when someone has all of the resources and when we've overcome all of that, if internally, that mother has felt like the message is that she is not allowed to not be okay, and that she needs to stay strong or continue to show up, then even if we bring the services to her doorstep, that is going to be something that we need to overcome. So I would say, the strongest barrier is this sort of narrative that exists within society that ends up trickling down into moms and families themselves, that really ends up being really challenging. And that exists even within providers, unfortunately. So I think, how do we change the narrative as a society so that we can actually prioritize funding and efforts to overcome some of those other barriers that really impact marginalized communities as well.
Something that just came to mind, was having a conversation the other day with some folks at the Maternal Mental Health Leadership Alliance, and they were talking about how the physical health and the mental health of the baby are often separated, and how the mental health of the parents are often looked at in separation to the health of the baby. But they're really, I mean, they're so interrelated and interconnected, and yet they still, there still is kind of a way of looking at the baby as this separate entity. What are your thoughts on that?
Yeah, I mean, absolutely. We certainly see that in the NICU, I think, especially given just sort of the history of neonatal medicine and the fact that I think in the very beginning, the focus was just on let's get these babies to survive.
Right.
And so with decades of advancement, we've actually been able to recognize, well, actually, this is really hard on parents as well. And we need to be holding the entire family. But in general, I think the field of infant mental health and perinatal mental health really sees families as a whole and does not separate them. But I think that there are other areas of healthcare that have a challenge with kind of viewing support and services that way. I think one really strong example is the way that mothers tend to fall into this gap of care after they have had a baby. So if there are no, physical complications, usually around 6 weeks, you are being discharged from your OB provider. And then the next time you may see a healthcare provider, it's the pediatrician who is, supposed to be there for your child. And so I can't say how many mothers I've worked with in the NICU who, have been discharged from their OB provider, but aren't connected to a primary care provider of their own. And so they really are kind of just left in this gap of having no services and having no one kind of hold their experiences as well, which I think, as from the healthcare provider perspective, we need to do better about holding the child and the family all together.
Right. And sorry, go ahead, Gigi.
No, this is fascinating. I could talk to you for hours, but I was just thinking about, when you talk about changing the narrative, is that also that just from a health system mindset is, we do function as from a point of deficit. Something's broken, you have to fix it. And so what you're really saying is, flipping that. We're collectively looking at this unit, and we are really trying to ensure that they thrive, and not only interact or intervene when something's broken, that we try to prevent that from actually even kind of taking that out of our vocabulary, but we're really trying to ensure that we put all the resources. So there's a continuum. And I love what you said about sort of during, because we got to remember, I always think about this. I don't know how the two of you think about this, is the NICU is just a moment in time. Right. And you have a snapshot, and there's so much that's happened with that family before, during, and what's so much going to happen afterwards. And so it's about that continuum exists. So I was just thinking about the whole idea about making sure that we change the way that we even think about health, that it's not a reactive thing, but it's very much a proactive way of how we're looking at families and looking at that continuum. Does that make sense what I'm saying?
Yeah, absolutely. I think that is so huge. And that's another one of those really big structural barriers that is going to take a lot of us pushing and advocating. For example, the things that tend to get funded or that insurance covers are deficit based. And so unfortunately, when we come up with solutions that are more proactive or strength-based or trying to support families early on, that sort of early intervention, those tend to get less funding and less support, which, even though research shows that we can save a lot of money in the long run if we are, intervening early on, is really important. And I think the other thing that came to mind as you mentioned that was, as Kira noted, this idea of promotion and prevention, which again is that sort of early intervention perspective. And so they basically mean very similar things in that we are trying to get in early, and we're not waiting till a mother or a family is really in a very tough place before we
Right.
intervene, but that we're thinking about this more proactively. But I think there are a lot of efforts, being done to try to engage in promotion and prevention. So if we think about promotion, it's sort of that idea that everyone can utilize what this intervention is. So everyone can benefit from it. So an example would be like, public awareness campaigns, or if doctors' offices have a brochure where they explain maternal mental health conditions, whether you're in that place or not, just having access to that is likely going to benefit you, because it might be the first time that you've ever heard of, I don't know, postpartum OCD, or, that sort of thing. And then, of course, prevention, thinking about how do we take a population who we know is going to be more at risk for experiencing mental health conditions, for example, NICU parents, and how do we try to catch them early on so that this doesn't, again, get to a place where things are really challenging. So that might be like screeners done in the NICU with parents to really see, who is already looking like they may be having a hard time, and how do we get them resources as soon as possible. But again, it's, these efforts, as much as we know they are helpful, they're not done in a standardized way, because oftentimes there's lack of funding or support to get them done, unfortunately.
Absolutely. You're so right. Making that point about what often gets funded and what's harder to fund are those early intervention prevention measures, which is, like you said, that's what we want, right? We want to prevent as much as we can the mental health conditions from even occurring. So let me ask you this. You mentioned that this is a community issue. Can you talk about that a little bit more?
Yeah, and I think we're speaking to that so much. And I think when I know I'm not the first to consider this community issue, but the way that I think about it is certainly that this is something we should all care about. So, as much as it shouldn't be about money, I think that economically speaking, when maternal and any parent's mental health issue goes unchecked, it ends up costing, a nation over $1 billion a year. It's really expensive to not be treating this. And one of the reasons for that is because when we don't treat and support parents, we know that there can be long-term negative implications for the child. And so the infant and child's development, and throughout their life course, the type of impact that is going to have. And so I think, that's one plug for why we should care. But I think even more important to me is this idea that it is all of our role to support mothers, to support parents, to support young children. As much as I think there tends to be this whose job is it anyway thing that happens in maternal mental health, where you're coming across a lot of providers. Let's say ideally you've had prenatal care, maybe you have a NICU stay, then there's the pediatrician. So there might be a lot of players involved. And unfortunately, sometimes people kind of pass the ball on to the next person or the next provider, or, if they do have access to a specialized provider within their clinic, then it's kind of like, okay, well, the psychologist will handle that, or the social worker will handle that. When in reality, if you are even touching base with a mom for 5 minutes, whether you're the receptionist, whether you are someone who's just coming in to do that screener and then you're going to put it in the chart, you have the ability to really demonstrate a sense of like validity, really validating that mother's experience, making them not feel alone in that moment, and really maybe opening their mind to the resources that can be available to them. So I think, when I say it's a community issue, I think that everyone has a role, and that everyone should find out what that is and how they can support. And I think that also includes friends and family as well. I think we don't always do a good job of bringing in people's village. They say it takes a village to raise a child. I think it certainly takes a village to raise a parent as well. And so how do we also equip friends, family, partners, fathers with the tools to support maternal mental health as well, because they are there and they're an untapped resource, I think.
Yeah. So to have a
Go ahead, Kiki.
more queer. I'm
Go
just
ahead. Go right ahead.
I mean, this is I just love it. I was just wondering then, what are your thoughts? Because you mentioned about one preventative strategy as being like a check. You didn't use. I don't know if you used the word
Screening.
checklist. Yes. I don't know. Screening. Yes. I don't want to put words in your mouth. The screening. And I was wondering about the silent sufferers within the NICU, and just personally, I think I was. I mean, because I'm wonderful with wearing my mask, like as we all do, and so I was sort of deemed a strong
You were
mother.
okay,
I
right?
was okay.
Yeah.
I was a strong mother to the point where I was even called on to help other NICU parents who were considered to be struggling. And
While you were
so
in the NICU yourself.
while I was in the NICU myself, we were there for about 6 months, almost a week shy of 6 months. And so that struck me when we talked about screening, because I probably would have fallen out of the barriers of the parameters, of the screening, because I didn't exhibit whatever, like you talk about the awareness bit, whatever they were looking for. I didn't, and I know I didn't, because I was deemed okay, to the point where I could help others. And so it's just something about, I just wonder about that. And in speaking to a lot of parents, a lot of other NICU parents, there are lots of silent sufferers, and they put on their superhero cape, and then, but internally they know something's not going on, and it begins to seep out, as all these things do within other areas of your life, because it hasn't been resolved. So what are your thoughts on sort of that kind of subgroup of the subgroup, if that makes sense?
Yeah, absolutely. Thank you for bringing that up. I think that for a lot of marginalized families, this is such an issue, that for a lot of different reasons, certain people do not feel comfortable speaking up, or feel, even more pressure to have it all together. I think that oftentimes for Black women, there is a certain expectation of sort of needing to be the strong one and needing to be the nurturer for other people. I know oftentimes in the NICU, there can be cultural or language barriers that make it harder to speak up or to ask questions or to advocate on your own behalf. And so really thinking about just blanketing, an intervention and saying that it's going to be effective for everyone is not helpful. So I think, the thing about screening is that it can be very, very useful. I think, research shows that it does decrease the amount of people that fall through the gaps. But I think we need to be really intentional about the way that we do screening. So I think first and foremost, we need to be thinking about who and how are we implementing that screening? So who is the person that is talking with the mother or the family going through that screener? I know that unfortunately a lot of places just drop off the paper at bedside. And so there's no one talking to you. You're just kind of feeling that out. And how easy is it to just be like, no,
Right.
even though you might be really suffering.
Yeah.
And, even when there is someone that's actually talking through those questions to you, how often do we actually explain the purpose to the person? That the EPDS is a very common one, the Edinburgh Postnatal Depression Scale. And that one, it is for depression, but it also picks up on worry and anxiety. And what kind of language are we using to help kind of connect with that family about what it's trying to get at? And then even after we administer the screener, how often do we sit and say, this was very brief. I'm wondering if there's anything that I didn't capture, or if there's anything that you've noticed that feels a little off that wasn't really captured here. And I think it's very rare, unfortunately, that we do that with screening. And so oftentimes there are still people who are falling through the gaps. And then that being said, even when you do, put all the effort into a screening intervention, there's still maybe people who don't feel comfortable sharing. And so I think that again goes back to this sort of community issue about what sort of culture or environment are we setting that helps people feel comfortable and safe enough to share that they are not doing okay. So I think in the NICU, there are so many different providers that families interface with. There's the nurse, there's the OT, PT, the child life specialist, maybe a social worker. If everyone has the same sort of approach to checking on mom, checking on dad, making sure the family's okay, maybe it would feel a little bit more comfortable skipping a day in the NICU because you need a rest, or sharing that you're not doing okay. But again, I think it means really changing the culture and making sure that all providers, no matter the discipline, are kind of educated and aware that these sorts of things happen.
Yeah. And and screening in the NICU, that's not commonplace.
No, it's definitely a huge recommendation. And there are several NICUs that are doing it as standard practice, which is amazing.
Yeah.
And also it is hard to have the resources, because if you're doing it well, you're doing it with everyone. And you're also following up whether someone screens as having an elevated score or not. You're giving feedback, and you're, referring them to the necessary resources. And so you need a lot of mental health resources to do that. And unfortunately, most NICUs don't have additional mental health resources outside of maybe social work.
Yeah, which is something we really need to change.
Yes.
And that's something that we certainly are supporters of. And I just want to read this one comment we have from someone who's watching, from Megan, who says, there's also the train of thought: if I share how I'm really feeling, what will happen? Will it affect my access to my baby? Will it change how others see me? And that actually just it brings to mind this mom that I worked with years ago, who, this mother, she had 2 older children at home. It was summer, so they were in camp. She lived an hour from the hospital, and she would take the kids to camp, drive an hour to the hospital, be with the baby, go back, because if she was, 5 minutes late picking them up, they were going to charge her $15. Well, that's gas in her tank to go see her baby. And she was so scared that if she wasn't there every day, that they weren't going to let her take her baby home. And she confided this in me. And when I asked if I could share it with the charge nurse, they were shocked, because they thought, well, no, of course not. We know how dedicated she is. We know that, she's more than capable of taking this baby home. But it just shows that, that fear and that kind of that disconnect that can happen even when the care team thinks they're doing everything right. There's something that's not connecting for some families.
Yeah. There's a real fear of your baby being taken away from you. I know a lot of Black families feel that, like that. I cannot say, and not just Black families, but a lot of people feel that way, that I can't say that I'm struggling, because to Megan's point, that something adverse is going to happen to me or to my family.
Yeah. And I think, fortunately, there's been a lot of efforts to educate child protective services around maternal mental health conditions, so that they are not sort of equating what could be postpartum anxiety with an actual intent to harm your child.
Right.
So that's really great. But also, families come into the hospital, into the NICU, with having had experiences with institutions like CPS or DCFS. And so we don't always know that history, but I think, for certain groups, there are these additional fears, or feeling like they cannot completely be themselves or completely be vulnerable. And so I think just having that in mind, how do we provide the education and a safe enough environment so that they can at least ask the questions, and then we can provide clarity where necessary.
Yeah. And that just ties it all back again to your comment about it being a community issue. It really, Gigi, you look like you're about to say something.
No, I'm not.
Oh, okay.
No. I just think I think you've brought out so many incredible points and food for thought for all of us to kind of take back and sort of think about how can we begin to empower our members and their respective communities around these things, like, around this issue, and what resources we can actually provide for them. So, that's my reflective look.
Okay.
I feel like,
absolutely.
what you just said made me have a reflection in something that I, recognize so much being in this field is that there is such power in people who've had a lived experience. And I think that I unfortunately often hear stories of mothers who have suffered for years, sometimes even decades, before they realized that what was going on for them was postpartum depression or,
Right.
postpartum anxiety. And I still feel like even then, like your story matters so much and can be so moving. And so I know we talked about these really big structural barriers and even barriers that are more related to healthcare providers. But I just think for mothers who are interested in advocating and speaking up, like your story is so powerful. I think it's often what gets providers to pay attention. So even if it's something that happened years ago, sharing that with a current provider and being able to share your perspective, there's so much room for learning and educating. Friends and family, again, like the community issue, I think the more that you tell your story and share some of those barriers and things that were helpful, the more that we can move the field in the right direction.
Yeah. And I do want to share this one comment from Angie, who's watching live on LinkedIn. And she says that the NICU in Children's Wisconsin screens everyone, partners too. It's amazing. The support team includes their March of Dimes NICU family support, child life, music therapy, social work, psychologist, PT, OT, ST, palliative, hospice, chaplaincy, and nursing and medical staff, which is really just phenomenal. She says it takes a village, a network of support in hospital and after discharge, or loss of a twin or multiple, infant loss, or maternal loss. So it can be done, right? It can be done, and there are a lot of institutions that are really doing it very well.
Yes.
Yes, absolutely incredible, Angie. Thank you for sharing that. We're just about at our ending time. So are there any final thoughts? I mean, I love that you you really started to to point out how important our stories are as parents of NICU babies, as lost parents, and that really is an important part of advocacy is the lived experience. What other kind of thoughts or kind of takeaways do you think we could give to other parts of that village that need to be caring for these families?
Yeah, I feel like, again, to add on to for moms of the feeling like you don't need to do it alone. I think organizations like NICU Parent Network, there's so many out there that I think help people learn about how to advocate and how to speak up. And I think very similarly, those exist for providers as well. And so for those community providers or institutions who recognize this and feel passionate about it, but feel like the support is not there, you are not alone. Many of us have felt that way. And there are networks. I think this expanding maternal mental health is all about relationships. And so when I hear things like what's being done at Wisconsin's Children's, like that's incredible. And so for people who are interested in learning about how did they do that, what barriers did they overcome, what strategies did they use, reaching out to people is something that people do all the time. So I think, if in your area, of someone who is serving this population and you want to collaborate or you want to learn from them, reach out. Definitely, I would encourage getting on listservs with other providers who specialize in this population. And then, of course, getting connected to those more larger organizations that we've kind of already mentioned, like Postpartum Support International, Maternal Mental Health Leadership Alliance, like those sorts of ways of learning about advocacy and expanding these services.
Yeah. And I think we do need to also put a plug in for the National Network of NICU Psychologists that you're a part of. Can you talk a little bit about what that network is?
Yeah, so through the National Perinatal Association, which is another really great place to get resources and get connected, a sort of subset of that is the National Network of NICU Psychologists. And especially seeing that not a lot of NICUs have psychologists. So for many of us who start to do this work, it can feel very lonely and isolating, but there is a membership, a monthly call where we get on and sort of talk about sort of the barriers and things that have worked. There is a retreat that happens every year. And on the National Perinatal Association website, there are a lot of resources. So there's handouts and different information about how to support NICU families. So definitely put a huge plug in for that.
Yes, absolutely. And I also want to point out, because you're right. I mean, that's the way that we learn and we grow and we make an impact. And one of the other listservs, I think that would be great for anybody who has an interest in NICU, perinatal, family-centered care, which all of this is a part of, is the FCC task force, which is another one that is great for information sharing. And it is, don't be afraid to reach out and say, how did you do this? How did you make this happen? Because, I mean, if people are doing this work, where they're promoting access to mental health services, they're promoting family-centered care practices, they're promoting trauma-informed care, they're not wanting to just hold the secrets to themselves, right? They're wanting it to be available to anyone and everyone. So yeah, and Angie says, happy to connect on LinkedIn or via email with anyone that wants to private message her. So thank you, Angie, for that. And thank you, Celeste. Gigi, do you have any final thoughts or questions? I want to make sure that we covered everything that we wanted to cover.
No, I think we need to have a part 2. I think this is brilliant.
Yes, I know. I feel like we've only just scratched the surface.
Yeah.
We really have. There's a lot more to talk about.
No, I just thank you. And thank you, Angie, for that. Because I think you will be hearing from people. And Dr. Poe, you will be hearing from people as well. So we'll be reaching out to you as well, Dr. Poe. So, yeah.
So, and Dr. Poe, where, if people do want to reach out to you, what is the best way to do that? Would that be email or LinkedIn or?
Yeah, LinkedIn or email are both great. I'm not sure if my email was shared, but
it wasn't.
Okay.
But people can always email us, and we can.
Yes,
I don't want to post your email for the entire world, but yes, if you are interested in connecting with Dr. Poe, please send us an email, and we will be happy to facilitate that. So, any final words or thoughts?
No, I mean, this conversation is just really exciting. Again, I know that there are moms who feel alone and like they can't access support, and there are providers who feel alone in doing the work. And so I feel really honored to be a part of this conversation, and I feel really excited about where the field is headed. I think actually this week we just learned that Congress is, officially recognizing the first week in May as Maternal Mental Health Awareness Week, which is huge. And so I think there are a lot of really exciting things happening. So I just wanted to say thank you for having me to discuss this.
Absolutely. Well, thank you for the work that you're doing. And we will definitely be having you back, because I think, like Gigi said, we've really just started. I think we definitely need to have a part 2. But thank you so much, Celeste, for joining us. And thank you, Gigi, as always, my wonderful colleague and friend and co-host. So I want to thank everybody as well for joining us. We here at NICU Parent Network are very intentional in our efforts to make participating in our offerings as simple as possible. So please just make sure that you're checking in on our Facebook page, our Instagram, LinkedIn, our YouTube channel. We've got a sign up on our website to make sure you don't miss any of our monthly offerings. So thank you so much, everybody, and we will see you next time.
Thank you.
Thank you.